Welcome to myeyeacademy.com. I'm Professor Mahfooz from Jinnah Medical College, Pakistan. Myeyeacademy.com is a unique platform for ophthalmic teaching for doctors, allied health workers, and patients. In this lecture, we are going to discuss clinical anatomy of the eye. Anatomy of the eye is described in three coats. The outer coat is complete and it has got two parts, the front 1/5 and the back 4/5. The back 4/5 is called sclera and is white in color. The front 1/5 is cornea and is transparent, and from the cornea light enters into the eye. Attached to the sclera is conjunctiva. The conjunctiva has got three parts. The part attached from the limbus up to the equator is called bulbar conjunctiva, while the part of the conjunctiva behind the tarsal plate is tarsal conjunctiva. The conjunctiva is folded on itself, and this fold is called fornix. It has got an upper fornix on the upper lid here and the lower fornix on the lower lid, which is here. Inside the outer coat is the middle coat, which has got three parts. The part which is close to the limbus is triangular in cross section and it is called ciliary body. Ciliary body produces aqueous humor of the eye for the nourishment of the eye contents. This part of the middle coat is called choroid, and the front part of the middle coat is called iris, which is the color part of the iris. The hole in the center of the iris is called pupil, which controls the amount of the light entering into the eye. The innermost coat is called retina, and part of the retina from where we see and where the most of the vision is called fovea. Attached to the ciliary body are suspensory ligaments, and from the suspensory ligaments the lens is suspended. Suspensory ligaments can change the shape of the lens for the accommodation to see for the far and the near. The part of the eye behind the iris is called posterior chamber, while the part of the eye in front of the iris is called anterior chamber. The aqueous humor is produced in the ciliary body here, and from here it comes into the posterior chamber, then through the pupil comes into the anterior chamber, and then gets drained through the trabecular meshwork mostly. Behind the lens is a cavity which is filled with the vitreous and is called vitreous cavity, and the gel itself is called vitreous humor. Let's revise the anatomy of the eye on the actual photographs. This front part, which is transparent, is called cornea, and this is the 4/5 of the outer coat, which is called sclera. Just behind the cornea is the iris, which is the colored part of the eye, and the hole in the iris is called pupil, and behind the pupil is lens. If you look at the back of the eye, this is the retina, and the center of the retina is called macula, and the center of the macula is called fovea. This whitish structure is called optic disc, and the center part of the optic disc is called optic cup. Now remember a mnemonic. Anterior chamber is in front of the iris, while the posterior chamber is behind the iris. I repeat, anterior chamber in front of the iris, posterior chamber behind the iris. Anterior chamber, posterior chamber, and the lens together are called anterior segment. Now everything behind the lens, including the vitreous cavity and the retina, are called posterior segment. In this slide, I will briefly discuss the anatomy of the eyelids, and I've represented the eyelids diagrammatically, upper lid and lower lid. Inside the lids is a fibrous structure which is called tarsal plate. In the upper lid it's called upper tarsal plate, and in the lower lid lower tarsal plate. Here are the eyelashes attached to the eyelids. Inside the tarsal plate there are meibomian glands which secrete the meibomian secretion through the meibomian duct. The top part of the tarsal plate has got attachment of the muscles of the eyelid in the upper lid and in the lower lid. To discuss the nerve supply of the eyeball, we need to remember a mnemonic which is SO4LR6. SO4 means superior oblique is supplied by the fourth nerve. LR6 means lateral rectus is supplied by the sixth nerve, and the rest of the muscles are supplied by seventh nerve and mainly by the third nerve. Superior division of the third nerve supplies the levator palpebrae and superior rectus, while the inferior division supplies the medial rectus, inferior rectus and inferior oblique. The sole sensory supply of the eyeball is trigeminal nerve, which is the fifth cranial nerve. Blood supply of the eyeball is derived from the internal carotid artery, which gives rise to the ophthalmic artery. The ophthalmic artery gives four set of branches. The short posterior ciliary arteries, which are about 20 in number, supply the choroid. The long posterior ciliary arteries, which are 2 in number, supply the ciliary body and optic nerve, while the ciliary body also gets supplied by the anterior ciliary arteries. The sole supply of the retina is central retinal artery. Thanks for being with me at myeyeacademy.com. Please do give your feedback at www.myeyeacademy.com. Thank you.